Don't need to be looking at my ceiling. Hello, folks. I'm Dr. Andi, and welcome to Tuesday Night Raw Q&A about feeding a species-appropriate raw diet to your animals. I'm here to answer all of your questions every Tuesday night on my Dr. Andi's World YouTube channel. 6 p.m. Mountain Standard Time, so Denver time. I am in clinical practice still for over 20 years now. I'm a certified animal chiropractor and a doctor of chiropractic. And everything I've learned from my own animals and from my clients' animals. I'm not a veterinarian, and none of this is veterinary advice. We do not have a personal client relationship. This is just the springboard. I want you to use this as a springboard, ask your questions, gather a little information, and then go and take it further. Go educate yourself, educate your friends, because friends don't let friends feed kibble. No more kibble, no more processed food, no more processed food in the house for you or your animals. None. Hi, Miss Keisha. How you be tonight? Let's see. I'm going to start with these, really kind of honing it in and really treating it as a question and answer versus me talking. Because, you guys probably don't, but I get a little sick of hearing myself talk and would love to have questions put up in the chat. I know we're getting into the summer months, and sitting inside for a live may not be a high priority. So let's bring our friends, let's bring our questions. And if we don't have any questions, we might just be popping off sooner so we can go out and enjoy the longer hours of sun and more fun in the summertime. If you caught the live last week, I do want to apologize again. I was fried. I didn't feel I was very articulate or had a lot of brain power to really contribute. So I do want to apologize for that. But I was getting ready to leave. I went back to Chicago to study with my mentor out there, who has an animal chiropractic school called Health Pioneers, and his name is Dr. Carl DiStefano, and he is a wonderful man with his wife, Dr. Dina. And I went and sat in on a module. It was his basic course. I like to think after 20 years I didn't need the basic course, but I want all the information I can gather out of his head, and I just want all of it. And it's always good to hear it again and hear it again and hear it again, and review and review and review, because as I like to say, chiropractic is neurology. I do not practice bone out of place chiropractic. I am looking for hypertonic muscles, weak muscles, what pathways are not functioning at tip-top shape in our animals. And we're changing that with all kinds of things like high velocity, low amplitude thrust, which is an adjustment for our subluxation. I work with interosseous faults. I work with muscle spindle cells. Like, it's not just bone out of place, and chiropractic is neurology. We reviewed cervical motion, the coupled cervical motion in the neck. I know some of this doesn't make any sense to you. You just know your animals move their neck, but they have to move it in certain ways for it to work properly. I had a little guy in, little high-strung little guy. He was really cute. He was a good boy. He did a really good job for his adjustment. And Mom showed me videos. I need her to send me those videos, because I don't think I instilled a lot of confidence in her when I said I've never seen a dog do that before. And in 20 years, that's a lot, right? Like, I think I've seen every dog do everything. But what he would do when his pain set in, was it from a muscle spasm, or was it from actually radiculopathy, or peripheral nerve pain, or in the cervical spine? He can't tell us that, right? He would kind of do this. He would lift that foot and turn. It was fascinating. I'm like, never seen a dog do that before. Probably didn't instill a lot of confidence, but went through my thing, did my thing. She came back for his follow-up today and says he hasn't done that thing again since we adjusted him, which is awesome, but he was still having some trouble going to the opposite side. And so we cleared out the rest of that, hopefully. Subluxations, we did some cranial work. We actually worked on cranial bones, because we and them, our animals, have cranial bones, and they do move around, and they need to be adjusted on occasion. So we did all that on him, and so we'll see how he does. But she's like, it was amazing, and I'm like, yeah, chiropractic's amazing. Going to class, a lot to learn all these things, and having health pioneers pioneer the way of receptor-based chiropractic is amazing in my field, which is so tiny, small little field. Us little animal chiropractors are amazing. Okay, let's see. Any questions coming in? I also I wanted to ask everybody out there, but it doesn't look like we have too many people joining us. I think the spring fever has hit, right? I wanted to ask a question. We'll see if we get an answer, and if not, we might just wrap it up and call it a night. Because like I said, I can listen to myself talk all day long, and you can hear me talk about all of this with Dee Dee Mercer Moffat on the Dog Food Truth podcast every Monday morning. She's gracious enough to have me on as a guest every single week. I think between our travel schedules, we actually had a replay last Monday. But we chat about all of this, and we'll chat more about my class. And she always has the best questions and gets me on the spot all the time. And we have a good time. And so you can always listen to me talk there on your favorite podcast platform. So you can always catch me there too. And then if you are in the Denver area, Animal Magic Care, you can get on my email list. We're in the process of getting some of those emails cited and up as some blog posts, so you can get to some of the back information. Right now, if you haven't been on the list, you can't get any of the back information. So we're working on that. We're going to get that up on the website. But if you want to get all the information going forward, you can join the email list. And then if you live in the Denver metro area, I am still taking new clients for the time being. We're probably looking at mid-June, beginning of July for those appointments. Just a heads up. Okay. My question to you. Name a process that I had the question, right? How do I want to phrase this? I was actually having trouble with it earlier too. So what is a diagnosis that has a component of inflammation in it? Like, how do we know our animals have inflammation? Like, from what our vets tell us, from what you know, what is the indicator that you have an inflammatory process going on with your animal? And thank you, Chandel. Hello there, dear. Hugely beneficial to have access to the back information. Yeah, I know. It's just a lot of work. And I know Miss Keisha is working her little batootie off. And so we're working on it. An MRI could diagnose it. Yes. But see, this is what it could show inflammatory process. It could show tumors. It can show space occupying lesions. it can show disc protrusions. It probably shows herniations, but our disc herniations clinically relevant, we don't know. Are they causing the symptoms? Maybe not. What I'm looking for is the itises of the world. Like when your vet tells you your dog has pancreatitis, your dog has arthritis, your dog has how come I can only, well, people have bursitis, dogs don't really have bursitis. Tendinitis, tendinosis, your itises was what I was looking for with that. Like when you are diagnosed with an inflammatory process, there's going to be an itis in that name that you are told by your vet, sometimes me. I don't tend to do a lot of, well, I don't tend to diagnose anything. I don't tend to put a lot of attention on what is this. I'm more interested in why is this, and looking at how we can impact the nervous system to change what is going on. So I know we're very much trained and entrained to give me the name of what's wrong with me. Give me the name of what's wrong with my animal. I want to know what's wrong. I need that name. But does that name really give you any more information? Sometimes not. But I don't tend to do much more. If you're sitting down with me, oh, the pelvis is rotated. Oh, the lumbars are tight. I rarely, if ever, T5, is, whatever it is, it doesn't really matter, because by the time I see you in the same visit, I go through my stuff, we talk about it, the dog's off the table, that thing's not there anymore. I have impacted the nervous system and we have changed it. So there's no real reason to dwell on what's wrong. Let's look ahead to see what's coming up. But back to inflammation. And since I am talking to people generally are already raw feeding, the new folks to the community, we love your questions. We would love your beginner questions. Those are awesome questions. I'm so grateful for them. So don't be shy. Pop them in the chat. We'll love to go over them. But folks that have switched to a species appropriate raw diet, we were talking in class and the facilitator is like, if you have a dog that has an inflammatory process, an itis, arthritis, IBDD is not it's an inflammatory process, but it's kind of it's a very dramatic diagnosis for something that is commonly shifted and changed with chiropractic. And vets like to scare everybody with that. They really do. It's very cute. But if we have inflammation and we're having limping and we're having lameness, we're not walking, we're having, some neurologic reflexes that are not present in the rear, which actually has more to do with weakness than any neurological damage. And again, is most commonly your dog can come in, walking, not necessarily walking on the top of the foot, but that reflex, when you place it, it's diminished. Like some dogs, I can't even get the foot turned. They're like, they're like, we're fine. We know where our foot is in space. Some you get it flipped over and it's just a little diminished. And then finally they get it. Generally, most of my clients go to the vet first. This is very prominent. It's all throughout their notes on how this reflex is, and the dog's not doing what it's supposed to do, and they're very concerned, and maybe they need the neurologist. Generally, if the dog comes in like this, that reflex is better by the time they leave. That's how fast chiropractic can impact that nervous system and change that. And it's changeable, which you don't hear from your veterinarians. Like once it's there, it's, it may always, it's not going to get any better. If they respond to the proper medication, reduce that inflammation, it'll get better. That's also a nice indicator that the meds are working and that maybe there's no need to go on to that next step of the neurologist or surgery. Each case is different. I don't know your animals, but we want to see response to medicine. And so we talked just a little bit. We talked just a little bit about reducing that inflammation, reducing that arthritis, that itis that's going on in the body is off kibble, off processed foods. Reduce the inflammation. It's meat, raw meat. There's nothing else there. Some fat's fine. That's going to be in the meat. Organ meat's fine. That's going to be in the meat. The bone's fine. It's going to be in the meat, but just meat. Get rid of the carbohydrates, get off the processed food, and gut dysbiosis. Get the gut dysbiosis taken care of. Find somebody in your community that can muscle test. Look into all different practitioners that are using different herbs that can help you get rid of the gut dysbiosis. We do, maybe not for a long time, but we want some prednisone on board and we want those animals adjusted. We've got to get the inflammation down. We've got to get the inflammation off the nerves. Got to. I had a regular client call me last Tuesday and I could not get her in. And I actually, if I wasn't leaving town, I actually would have booked her for a couple days out. Like she called me last Tuesday. I would have probably booked her for the next day or maybe Friday or somewhere in there. I really would have, and I would have sent her to the vet because the dog went chasing after the cat down the stairs and fell down the stairs. And it's an older dog and we're already struggling with our knees and it's not a good thing. And she's like, I don't want to go to the vet. They're going to give me pills. I'm like, you're going to need those pills. So get there today, but I just could not see her. I gave her references and I don't know if she followed up on it or not. She's got a lot going on in her life. We're all busy, right? So I circled back around with her and I got her in today. So 1 week later and the dog walked in really nice. And this reflex was not present anymore. She responded to the meds and mom's asking me, she's like, well, what do you think? I'm like, she still needs to do some healing. I mean, she fell down the stairs, but she responded to the meds. I don't see, and we did a really nice adjustment. She was really happy with that. The dog was, mom was too. She had some cookies. She's moving really well, but she's like, she could not get up. And I'm like, yeah. But we got to the vet that day and we got the prednisone. We got the inflammation off the nerves and she's already raw fed. So she is way ahead of the curve. Way ahead of the curve. Because when something like this happens, and then I'm going to tell you, now you need to change the diet too, if you really want your animal to get better. That's a whole nother stressor on top of your animal's not doing well, right? And that's a lot of work. So let's do something that humans are really, really bad at doing and doing some preventative stuff and get the diet changed now. And that may help in the future. And the future, and then if something does go, maybe we actually prevent what could happen in the future because we're already going to reduce the inflammation systemically. Or if something does occur, that that we can actually heal up faster. And yes, Chandel, those meds do not heal jack all. There is no healing from the meds. Which is not what conventional medicine's like, oh, your symptoms went away, you're all healed. That is not true. Your symptoms went away. You still have your root issue. You have your root problem. But what we're talking about is in an acute stage of the process, and we need meds to stop symptoms. Like we need them. We need some steroids to reduce the inflammation to get the pressure off the nerves. Because what is the largest space occupying lesions in the spinal column? It is inflammation. And if you don't get that inflammation down, you cause a lot more damage in there. So we're talking a very specific nerve issue. And it doesn't always have to be in the spinal column, but we have inflammation from just tight muscles and maybe some bruising, and just the healing process will cause inflammation. So we need to get the inflammation down. So short term, absolutely. Chronically, no. No. I had a client in today, but my long term with prednisone is very different than veterinarians. Depending on what we're dealing with, depending on the circumstances of the dog, depending on the circumstances of the owners, are they willing to do surgery? Do we need surgery? How big is the dog? Every case is so individual. And I don't do cookie cutter chiropractic. I don't do bone out of place cookie cutter chiropractic. Every dog gets evaluated every time they come and get on my table for whatever is going on that day or that week or that issue. But I really, if we can get them off the pred in 3 months, I think that's really good. If we can get it off sooner, absolutely. We do it sooner, but I don't see a problem with 3 months over the lifespan. Now, anything more than that, and yeah, and I'll say it again. Prednisone's an ugly drug. It's been around forever. It is cheap. It causes the animal to be hungry. It causes the animal to be thirsty. It causes the animal to retain water weight, lose muscle mass, disrupts the endocrine system. It does not actually help with the healing. Absolutely not. It actually diminishes the healing of the body. But what it does and what it is so good at, and because we know how ugly it is, I much prefer to swim in that pool than the pool of all these brand new drugs that we have no idea what the side effects are or long-term uses. I'd much rather swim with the double I know. All right. That's how I look at it. And my target is always to get them off of stuff as soon as we can get them off of stuff. Okay. So I'd much rather swim with the devil I know. Plus, it's cheap. It's generally easy. You can even do a shot if we really need to get in there super duper fast and follow up with the pills. That I worked with many moons ago. That's where I learned all my stuff about pred was through him, and he did amazing stuff with dogs that were paralyzed, spinal cord injuries. He worked with a lot of clients that could not afford surgery. He did amazing things. He would do the shot with the vitamin B12, and so it looked like Pepto-Bismol, and he would do that and follow up with pills. He would do, back in the day, DMSO, which I really wished he would warn me, because if you touch an animal that's done DSMO, you taste garlic in your mouth. It was not great. Sometimes he didn't warn me. As an anti-inflammatory. He did amazing work back in the day. And that's where I learned a lot and saw a lot. And he would leave them on there for 3 months. And I would be adjusting them on periodic schedule. And really the vast majority of them got better. It took a little bit of time, but they got better. I have not found a veterinarian that's comfortable doing that in a very long time. And parents generally don't have the patience for it. And I always give my little patience speech when we have a dog that's down, meaning that generally the back legs stop working for whatever reason. And I ask them flat out, I'm like, is surgery still on the table? Because you probably want to go do that if it's on the table. If you have insurance and you want to go do that, I would probably go do that. Is it needed in all cases? No. But I just find people don't have the patience to move an animal around, express bladders, make sure they're on a schedule and get them out to poop. They're not willing to change the diet. They're not, getting them in and out of the car. It's a lot of nurse care, and people don't have the patience. Now, some do when surgery is off the table and they do this, or they have to put their animal down. So no, meds don't heal. They handle symptoms. And that's all that's generally what they do. And I do have the point of view that there's a time and a place for everything. Absolutely everything. And it's just all on an individual basis. It's all, at different times in your animal's life, you're going to have different conversations about things, and it's just what it is. So, if you have an inflammatory process, you have an itis in your dog's body, change the diet. Get them off all processed foods, including all the damn processed treats, and no pumpkin. No sweet potato and no pumpkin. Fix up the gut dysbiosis. That may be as simple as adding in a soil-based probiotic or a different type of probiotic. It may not. We may actually need someone to get in there and evaluate for bugs. Finding a BICOM practitioner in your area would probably be a great place to start for that. Inflammation on the nerves, we need to get the inflammation off that nerves. You need a steroid to do that. It's the only thing that works. If your veterinarian's not comfortable with that, then at least get a non-steroidal, an NSAID. They don't work as well, but get something to get the inflammation down and get them adjusted. Go see a chiropractor, especially maybe someone that has trained with Health Pioneers. Is a receptor based, but if they're not in your area, find a chiropractor. Chandel says it's been a journey to realize that these ailments don't appear overnight and they aren't going away overnight. That's an excellent point, and it's hard, right? It's hard for people to realize that. Yes. Like I talked about a client that was in a couple months ago now. The dog walked out to the backyard to go potty and dragged her butt end back in the door. So we would like to think that just happened. It didn't just happen. That had been brewing there for a long time, whatever it is. They were not willing to do an MRI. They're not willing to do surgery. I don't know what actually has happened with the dog. She chose to go a different direction. The owners did. But this dog was kibble fed, I think Costco food. She was probably 10 to 20 pounds overweight. I'm not very good at determining that. And so that although she walked out the door and drug her butt back in that door, that did not just happen. That had been brewing there for a long time. She had never been adjusted prior. She had never had any massage, no acupuncture prior. It's fine. Most dogs don't. Like, I think about all the dogs on the planet. Very, 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 very few get any hands-on body work. Okay. So I'm not making that a wrongness. It's just the fact of, but that was whatever she did. And all she could have done, nobody saw it, was turn around. And it was the last little straw that broke the camel's back. I had a somewhat regular client. She's been coming in for years. I don't know, 3-4 times a year. She's this cute little white fluffy dog. Everyone, is like, oh, I got a cute little white fluffy dog. She's adorable. She screams. She tries to bite me. It's fine. And she's an only child, so she's spoiled rotten. Only dog child. And she went to her grandparents' house, and they gave her a bath, which is very run-of-the-mill. This happens, I guess, often enough that, she gets a bath. No big deal over at Grandma and Grandpa's. But she came back all, her neck was in spasm. Now, she first came in to see me because of luxating patellas. And they went and had surgery on one of the knees, which is now the worst knee. But it is what it is. And so she comes in regularly for these little luxating patellas and her little low back pain. But today, that was not what was going on. And they wanted to know what happened. I'm like, who knows? And, of course, Grandma feels terrible, right? Like, broke the dog, giving her a bath. I'm like, the bath was probably the final little straw. We had a really cold, icy, for Colorado, icy winter. She could have slipped on something in February, been sleeping funny a few extra times in between, had her regular bath. Maybe she got a little chilled and those neck muscles just went, and that was it. That was the last little straw. So did that just happen? No, it had been brewing. Now, I hadn't seen her since, I think, Christmas time for an adjustment. It's not that long, right? She was all worked up. I do my thing, follow the pathways, test for what needs to be adjusted, get it all done. About halfway through, she just kind of settles down. So I tell Mom, I go, her butt doesn't hurt today. Her butt's in great shape. Now, is that true? Or is the front end so on fire, so taking up the vast majority of the nervous system's energy right now because it is so unhappy with its spasming and nerve involvement and all that the back end's, just not, the body's like, don't worry about the back end today. Most likely, right? And so we get all that fixed up, and when we have an appointment in 2 weeks. And so she'll be back, and we'll get hopefully the rest of that. But it takes 24 hours to integrate all that information. She looked better. She felt better. Her ears were up before she left. We made some changes. We changed the synaptic pools. We got some of those muscles to chill out. We had some pressure off the nerves, and she'll be feeling better. But that didn't just happen. Nothing just happens. You don't walk into the doctor's office and get diagnosed with type 2 diabetes because that just happened because you walked into the office. No, that took 20, 30 years of a junky American diet to get you there. Now that you have the name, how'd this happen, right? How did I get here? This just happened to me. No, it took a very long time, and the body is very, 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 very good at compensating for a very, very, very long time until it doesn't. And then, everyone kicks into action. So let's do some prevention. I know it's a dirty word. It's dirty words. Chiropractor's nightmare is that word. And getting people to do prevention, because you can never prove that if I did all this work, am I better off, right? Because you prevented so much. I love to tell my clients, what if this is 100 times better than it could have been if you weren't in here every 6 months for the last 3 years? Whatever, right? Like, what if this is actually easier because you've done all these things? What if they get sick at 14 instead of 11 because you went to a raw food diet? So you had 3 awesome more years, and you prevented something for 3 years. But we still ended up getting there because the body still ages, right? But you don't know. Like, I fed raw and I did all those right things, and we still had this at 14. Yeah, well, what if you would have gotten it at 8 if you didn't change the diet? What if, I mean, like, that's why prevention is so hard in our brains. Like, we can never prove that we actually prevented something because it never happened. So we prevented it. And so we get really kind of worked up in our heads about it. Right. It's like, yes, We've all done that, right, Keisha? We've just turned our head and whoop, the whole night. My back went out. It's been a while. Well, actually, there was Mother's Day, but before that, not this Mother's Day, it was a few years ago, Mother's Day. I was working in an agility trial, so I'm standing in uneven dirt. I have my table. When I worked agility trials, it was every 15 minutes I saw dogs. I mean, it would be 30 dogs a day. Like, it was insane. I can't do that anymore. My body's like, no, we can't do that anymore. But I had a moment, and I was standing and I was watching a dog run, do the things, right? And I'm just standing there. I didn't even move, and my whole back went, meh. And I went, that's not going to be good. My QL just went, meow. I hate you today, Andy. And that was that. I went home. I actually medicated myself with some narcotics. I had to go to dinner with the family, and I got my cute little Padootie. It was either Saturday or Sunday, probably Saturday, to the chiropractor Monday morning. I did ice. That was an acute injury. We've talked about this. Acute injuries get ice. If you really need to do heat, you can do contrast therapy, but you have to do the heat first and then the ice. And you can do it on your animals too. And if you have like a big fluffy white dog, you can do like 20 minutes like we do us. You try to do 20 minutes of ice on your little no-haired Chihuahua, they're going to be really unhappy with you. So 3 minutes. I'm happy with 3 minutes. The other thing you could do with them, which if your dog likes those percussors that they have at Costco, and they like that, you can percuss the area. You can move those muscles around, because whenever you do that, you bring new blood to the area, you flush out the old toxins and the old blood and the inflammation. You reduce the inflammation. So you can percuss it and put some ice on, whatever you think hurts. Or what, it's fine. It's fine. Do your best guess. You're usually pretty close. But for little Chihuahuas, those little percussors are a little much. So you can use your electronic toothbrush and work on their little muscles. They actually kind of like it. Works pretty well. Just a little side note. And then you can do you might want to do like heat on those little guys, especially in the winter. You know, they have their coats on and they're in their heated blankets and their beds. It's, and you want to stick ice on them, like, good luck. But you could do a little bit of heat and then a little bit of ice and then let them go, then let them go back in their heated bed. I mean, you can only do so much, right? But acute injuries need ice. So I iced it, and I was just standing there. Right? I struggled with sciatica for 3 years. Did all the regular things, chiropractic, the stretching, the ice and heat. And I finally had to, and this is when I really cut down on my house calls. I had to stop doing as much driving as I was doing because it was really aggravating the issue. So you also have to find out what's aggravating the issue. Same thing with our animals. It's funny, if I get a household of animals, and I first noticed this, I don't even know how many years ago, because they are still clients, and they have been clients for like 19 years. Like, they put up with me when I was not a very good chiropractor to now. Because we all just get better with experience, right? And they had 5 boxers, and every single one of them had the same subluxation in their cervical neck, because they all came down the staircase, hit the hardwood floor, and made this and banked like the same way. They all had the same restriction. And I recently just found that on another family of dogs that came in. They all had the same restriction because they must all do something. They either, come down the stairs the same way, or they Superman off the deck the same way, or they run the fence the same way in the same path around bushes or whatever. But they all have the same restriction. So it's just fascinating, because we all move a certain way. Like I sit, I generally cross. Let's see what I have my left over my right at the moment, but usually I cross my right over my left. Like, how do you always sit? How do you always sleep? Our animals do the same thing. And so they're stressing certain joints all the time. And so that's why us chiropractors are always regular preventative maintenance care, because we move our bodies and our animals move their bodies. And if they can do all that and do all the dog stuff that they do, and we do all the people stuff that we do with less inflammation, we have a chance for less injuries. And if we can do it all with less inflammation, a raw meat diet, no processed food, no carbohydrates, very little veg. And if you are doing veggies, none of the starchy veggies. Reduce carbohydrates, no more processed food, no more junky treats, even if you're feeding a raw diet. And if you're cooking, that just boggles my mind. And this is just me. This is me right here. I don't know why I would cook for my dogs when I can literally take a knife, slice open a chub of meat, and throw it in a bowl and feed it. Why would I go through all the trouble of cooking? And when you cook, you lose nutrients and you have to add back in stuff, and you've got to pay a lot more attention to all the supplements and all the micronutrients. There we go. And that just boggles my mind, but some people like to cook. I think it also gets a lot more expensive unless you're adding in a lot of carbs, which is why most of even if you're not feeding a kibble, you're feeding something else out on the retail market, they have to add in a lot of other stuff because the meat's just too expensive to sell just meat. That's why I strictly recommend Raw Dog Food and Company. Like, look at their ingredients. There's meat. They do have a blend that has veggies in it. I rarely ever feed it. You can if you feel the need. But they don't have anything else in it. Like, turn over the bag of some of the retail raw next time you're in one of those stores, which I can't tell you last time I've been in a dog food store, big or small, boutique or box. I couldn't tell you. I order everything from Raw Dog Food. And I do buy bully sticks from Costco. I will admit that one. And I still do go to Costco. It's about the only place I go these days, shopping out in the real world. Otherwise, I have lots of vans show up in my driveway and drop off stuff. I love it. I don't like shopping. I never really did. Let's see. Anything else? See, I ended up prattling on anyway, but I think we covered some really good, maybe some additional information about inflammation, and all of it contributes to the systemic inflammation of the body. And then when you have an acute injury, you may have a localized inflammatory response in that area. But if the whole system is horribly inflamed from diet, from gut dysbiosis, from no previous body work, from just following traditional care, the injury and the process of actually healing can be a lot longer. And back to little white fluffy dog. I also told her I told Mom, she probably is going to heal up even faster, even though this is the other side of her. Like, this is her neck, not her butt thing, right? Because she's been previously adjusted. So her body's been trained for years on what to do when it gets all this new information. The nervous system does know what to do. But when you train it by going to a chiropractor on a regular basis and something occurs, the body's like, I really know what to do with this. We can get this realigned and straightened out super fast. Thank you, Keisha. Daily exposures to everyday toxins can play into inflammation. I mean, that's like, yeah, absolutely. Like, and everyday toxins I mean, I've been diving down that rabbit hole a little bit more for myself. I don't even know how many years I have pretty much eliminated all plastic containers in the house. We only feed in glass. The dogs, we only eat in glass. We only store in glass, except for plastic bags. I haven't gotten rid of the gallon-sized Ziplocs, but everything comes in plastic, and all of that is leaching toxins into the water and the food. Yeah, it can be a whole conversation in yourself. But I wonder if, like, in a lot of our daily toxins, especially as women, is all of the skincare, hair care. Like the amount of stuff that's in that's toxic. Like lavender is estrogenic. How many of your body care products have lavender in it? Now, I don't know if dogs are subject to as much of that because of the fur, and they don't put a lot of that stuff on them. One really quick thing, and then yeah, I know, lavender. Yeah, we can have a whole other conversation, Chandel. And I know you're coming in soon, so we might, right? But dogs do walk on stuff. So one really quick thing, and then I am going to wrap it up for tonight. And so I'm going to thank Akisha and Chandel for being here. And I want to thank everybody in the future that watches this replay. So grateful for you. Pop in any comments you might have. I kind of check back on this. I know Keisha kind of checks back on this, but we're doing our best. The Swiffer, the Swiffer that has the liquids on those pads, beyond toxic. Get rid of it. Stop washing your floors with anything, pretty much anything beyond white vinegar. But the stuff that's on those Swiffers are horrific. They're horrific for your dog's feet. They're horrific if you let your small children then crawl along the floor. It's awful, 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 awful. Okay. And that's indoors. Oh, yeah. And all those plugins for breezes, smell good things that are in that aisle, bypass that aisle at the grocery store, toxic. And then if you put in a plug-in at those outlets that are at your dog's nose level, could be contributing to all kinds of issues that your animal is having. Okay, two things. I had two things. I can go on about that too. Yeah, but women, throw out all your lavender. Yeah, that's fun because it's in a lot of things. Oh yeah, and aloe. Aloe is also estrogenic, which isn't about everything. I'm like trying to find something that doesn't have aloe is kind of amazing. Xenohormone mania, yep. So xenoestrogens, look it up. It's a thing. It's a scary thing. And then you just do the best you can. And one of those things is getting rid of all the processed food in your house for you and your animals. Chuck it. Get back to whole foods. And the more people that do it, maybe we'll make a bigger and bigger impact on big food. Maybe. Okay. I'm out of here tonight. Thank you, gals, for being here. Thank you all in the future that catch this. I hope you learned something new. I hope it sparked something for you to go out and learn some more about. I will be back next Tuesday. I think it's May 30th. There's 5 Tuesdays in May. Next Tuesday, 6 p.m. Mountain Standard Time, Denver time. I will be back here. Dr. Andi's World is the channel on YouTube. Bring a friend. Bring a question. Bring a friend. That's your summer's homework. Bring a question. Bring a friend. And Animal Magic Care. If you're in the area and would like to make a chiropractic appointment or get on my email list, you can do that there. Raw Dog Food Truth podcast with Dee Dee Mercer Moffat, CEO and president of Raw Dog Food and Company. Every Monday morning, we're chatting about God only knows what. Usually chiropractic and how that impacts your animal. But the number one thing, and we say it all the time on that podcast, and I say it here, is changing the food. Get rid of the kibble, get rid of the junky treats, get rid of processed food, get the carbs out of your dog's diet, because friends don't let friends feed kibble. And that goes for all of you guys too. All the people, get rid of the processed food, everything out of the house. Go through the cabinets. You can part with it. You can do it. All right, my friends. So grateful for all of you. I will see you next week. But until then, how much fun can you have with your animals? Bye-bye.